Hey there, family. I'm Mark Moore Jr., the host of the Young Leaders Conference, and I am fully persuaded that in times like these, it's borderline hypocritical to call ourselves a leadership conference if we're not going to lead. And so we want to be intentional about providing and equipping our community and the friends of our community with the necessary, relevant information that they need to know to navigate these tumultuous waters as we are in a global pandemic. I'm excited because I have a very, very special guest with me tonight that is a part of our team, and she's also one of our healthcare workers. Would you help me welcome Ms. Joya Lowery?
Hello, everyone.
Good to have you with me, Joya.
Thank you for having me.
I'm very excited.
Absolutely.
And in all seriousness, we need your expertise.
Sure.
I think that it's important that our friends know that you're not wearing scrubs tonight simply to make a fashion statement.
Not at all.
But you've been in the healthcare field for how long now?
Over 11 years now.
Wow,
Yes,
that's incredible.
absolutely.
And so that lends to the credibility that you have, and this is why we want to talk to you.
Sure.
Because even using that credibility word as a launch pad, I think that part of what makes this unprecedented situation that we're seeing so bad is the fact that there's so much misinformation circulating.
Absolutely.
I don't know about you, but every day I'm receiving multiple top secret text messages from friends in the government.
Absolutely.
Friends of friends. My cousin just told me he's ready to shut it down.
Right.
And so all of these things are really kind of feeding the misinformation.
Sure.
I want to start here. What are the actual symptoms, Joya, of COVID-19, the coronavirus? It's interesting that unfortunately we find ourselves in between seasons. We're in between flu season and allergy season. I've seen people, if somebody sneezes, if their eyes water, if they blink too fast, people are nervous. What are the actual symptoms?
Absolutely. So the CDC has been reporting that most people that come in, they have respiratory illnesses. So that looks like the shortness of breath, the difficulties breathing. And then of course it's accompanied by fevers and a dry cough. Now it's like you said, because it's flu season, a lot of people experience those type of symptoms. But with flu, you'll still have your muscle aches, you'll still have those headaches and different things like that. But it's very important to know the difference between those symptoms, because you don't want to cough and it's not that important and then you're running to the hospital, right? Because that's what we're seeing. We're seeing an overwhelming numbers of people that are going to the ER and they don't need to be there right now.
Is that kind of backing the system up?
It is backing the system up because there are some, we're seeing it all the time, is cases being revealed and these people need that attention. So think about it like this. If it's respiratory issues that people are having and you're coming in and it's over 50 people in the ER, they're trying to make sure that they're really dealing with the severe cases, and that's very important right now.
I'm glad you clarified that. I was on a plane just the other day, and I have very bad allergies, and it was pollen in the city I was in. And I'm telling you, I've never held in a sneeze so bad in my life.
I can't cough. Absolutely.
So it's important that we know the symptoms, but let's go a little bit further because people are watching and people need to know what are the precautions that we can take. We're hearing different things from different sources. It's airborne. It only comes from contact with things. What are some precautions that people can take without having to go to the hospital, without having to go to the urgent care? What can we do to try to prevent the spread and try to prevent ourselves from contracting it?
Well, there's several things that I really want to point out. One, we have to listen to our state and our local authorities. If they're telling us to stay in our homes, let's do that, right? Another thing, of course, you want to make sure that you've been hearing it, you've heard it probably because jillion times now, wash those hands. Make sure you're washing your hands 20 seconds. And at this point, it's not after you use the restroom, because we're hoping that people have been doing that, right?
That should be a check already.
It should have been a check before. But make sure you got to make sure that when you touch that doorknob, an elevator, a phone, gas station, you're washing those hands. Another thing that's very important, because like you said, you pointed out, I have my scrubs on. And I went to see a patient before I came here. Right? And so she's an elderly, but she's an elderly patient and she's afraid. I'm coming in with this good immune system, but she has some illnesses that she's already been dealing with. And those are the people that's at risk.
So it's affecting our seniors even more.
Our parents, our grandparents that already have some illnesses that they're already dealing with. So it's important, if you don't have to go out, stay in the home. Another thing that I want to make sure that people people are doing is maintaining their health and boosting up that immune system. We can work out. Even at home, you can do your squat. You can turn on some church music, get some 30-minute of cardio,
YLC
pick them up and put them down.
Wide selection of
there it is. Get your cardio in. Make sure you're getting your fruit and vegetables. USDA recommends that you get at least 5 to 9 servings of fruit and vegetables every day. You want to make sure you're getting that adequate amount of sleep. That helps you build up that immune system. Don't be that person that says, I'll sleep when I die. The devil is. No, get some sleep. If your body's talking to you and telling you that it's tired, go to sleep. And then another thing, which might be a little bit hard, but I believe that we can do it, we got to manage that stress, because that's going to keep our health up, and it's going to keep our immune system up. So make sure you're sleeping, you're working out, you're getting your fruits and veggies, and you're managing your stress.
Wow, that's extremely helpful, but are there some potential supplements or vitamins that you're suggesting? I know a lot of people are really running to the stores and getting stocked up every day. It's such a fluid situation. By the time our friends watch this video, the state will have changed.
Something totally different.
Absolutely. So certain states are starting to institute lockdowns. People are trying to stock up. As they're getting those last-minute runs into the grocery store, to the pharmacy, are there any supplements or vitamins that we should be taking? Of course, there's no vaccine for this at this juncture. It's so new. But is there something we can be taking?
Absolutely. You want to make sure that you got your vitamin C. You got to make sure that you got your zinc, echinacea, the vitamin D3. You want to make sure you're doing that. But then for those that have prescriptions, at least a 14-day supply of prescriptions. You want your pain meds, your Advils, your ibuprofens, your aspirins, if that's what you take. I'm a person that I don't really like to take medicine, so I do my elderberry, oregano oil, colloidal silver. Those are all things that's going to help me keep my immune system up and ready to fight just in case something does happen.
I cannot thank you enough. I know those of you that are watching are, I hope, taking notes and getting all this in. I want to be clear, because we are unapologetically a faith-based organization.
Absolutely.
And so at the end of the day, we will still stand on the fact that God has not given us a spirit of fear. We're not sharing this to cause you to panic, but we do believe that He has given us power. He has given us love, but He's also given us a sound mind.
Absolutely.
And so we are challenging you to use the sound mind He did give you to combat the fear He did not give you. Let's use wisdom in this season. Let's stock up, do what we need to do. And I'm praying that not only will you digest the information that Joya shared with us, but share this with somebody. You've got parents that need to hear this. Friends, co-workers, people at your church. Find that button, like, share, and subscribe. And remember, at the end of the day, what your medicine can't do, God can. We love you. We're praying for you. We'll see you soon.